Welcome, everyone. Today, we are excited to be talking to really our friend, Leanne Page, somebody who we've known for many years. I think we had her back on the podcast, one of our first few episodes. So you should definitely go and check that one out. Leanne is a BCBA and parent coach and really just like a wealth of information. And we're excited to be chatting again. Hey, Leanne, welcome.
Thank you. I'm happy to be here again.
So for any of our audience who maybe, for some reason weren't listening to our podcast the first like few weeks that it existed, could you introduce yourself, tell our audience a little bit about you and what you do?
Yeah, my name is Leanne Page. I have a company called Parenting with ABA. You can find me on all the socials under Parenting with ABA. I started it to teach moms the science of behavior when I realized everyday moms just need this science. Oh my gosh, we need the tools, we need the support. So that's what it exists for. I do parent coaching there. And then I also teach behavior analysts how to do compassionate caregiver support. So I do the professional facing side too, which is really fun.
When we started How to ABA, I had, three little kids when I became a BCBA. And
Uh-huh.
I really struggled with like, where do I apply, my skills to? Do we become a resource for parents? Because I really love the idea of like giving parents tools. Or do we become a resource for professionals? We know how that ended. But you have really invested a lot in the parent side of things. Why do
Yeah.
you feel like that's, such an important component?
Oh goodness, that's kind of been my calling, I think, to really focus on even moms specifically within parents in general. Because the parents are the ones who are with the kids 24/7, right? So I think you guys are doing amazing work to teach the professionals how to do it, to go serve all the parents, the trickle effect. We've got the ripples in the pond situation, but especially lately within, my new journal that just came out and all my content that I put out, really focusing on mental health for moms and how we can use the science of behavior to support ourselves as moms more than doing a first then with your kid all day or more than teaching token economies to parents or that sort of thing, but really thinking more about we as parents or the people I serve as parents, um, taking care of themselves first so that they can be available for their kids and be the kind of parent they want to be.
When I was younger, and I've talked about this before, but when I was younger, I used to just, here's an ABA approach, and
Uh-huh.
parents, you've got to just do this, and it's your responsibility. Here's your data sheet, and do it and go. And a couple weeks later, I'd go and check up on them, and nothing's been done. I'm like, what do you mean? Come on, like you've got to do this. Come on, let's just do it like this. And there was no consideration for parental mental health or trauma or any exhaustion. I think that would be a
Right.
big word for parents,
Mhm.
especially dealing with, a child with autism, but then four other kids that they have, or, sick parents, and you've got young kids, and you've got that true sandwich generation as well. It's a lot
Yeah.
for parents for sure.
And I was the same way. I did some terrible recommendations for parent training when I was first starting out, the same of like asking too much of people, honestly. And I still hear that a lot in working with behavior analysts and getting to, speak and do continuing education. That trend is still existing. And I think that's where you guys come in. And that's where I come in to try to say, no, we want to meet them where they're at and, do behavior change that matters to them. What does this family need? And sometimes a lot of times that starts with helping the parents figure out what's going on with their own emotional regulation and that sort of thing before jumping into a big, long behavior plan.
It's so true. I mean, as BCBAs, we want everything to happen yesterday, and we're very eager, which is
Yeah.
so awesome. But at the same time, we do need to sometimes move slowly with parents. But that
Hmm.
parent coaching piece is so huge because, like you said, the parents are the ones who need to carry through and follow through after the ABA people leave for the day. So, we're talking a lot about behavior, managing challenging behaviors, but also emotional regulation and how important it is for kids to have these emotional regulation skills. What are your thoughts on that in terms of kids having the emotional regulation skills, parents having those regulation skills? Where do you stand with that?
I have learned a lot in the last few years. I feel like my own perspective has shifted since my early days in the field. as a older BCBA, I really have loved learning more about co-regulation and the neuroscience behind it. I am not an expert on that, but I can give your listeners people to go read and listen to who are experts on it. But really understanding that these kids need that safe grown up to help them co-regulate. And it's not our job as the grown up to say, go handle it yourself, go do your calming strategies over there by yourself away from me. But really being the calm so that they can borrow that, they can take it from the adult. So a lot of parents that come to me for parent coaching, it's because they want their kid to regulate their emotions, right? There's some sort of
Like,
behavior
fix the kid.
issue. And they are rudely awakened when I always start with the grown-ups first. Like, I'm sorry, I know you don't want to hear more work for you. And it's not more work, it's learning, what does your body need? What does your body feel like? Let's figure it out for grown-ups and then model that. And then we carry it over into the kids.
It's so true. We had a mentorship meeting today. It seemed to be the common theme was
Mhm.
parents. And a lot of the
Uh-huh.
questions were, how do I get parents to follow through? This parent won't do this. This parent won't do that. And we try to encourage people to, take a step back, because a lot of what we think about as BCBAs is we want to get the technical thing done. We are
Mhm.
technological. That's what we do. We want to make change, but we have to really remember to take a step back and think about, with anything that behavior change you want to make in a client or a student or a child, there's another person involved, and you
Mhm.
have to acknowledge that other person is contributing to the environment, to the dynamics.
Yeah.
And without acknowledging what the parent might be going through and their trauma and their stress, and now you're asking them to also put in a sticker chart or a reinforcement system, you're not acknowledging the full picture of really what the child is going through, because the child now is also dealing with a dysregulated parent, somebody who maybe doesn't have their act together or had some stressful events happening in their life. And by giving them more work to do, we're not really acknowledging the full picture. And that's what we do as behavior analysts, right? We're supposed to be
Yeah.
able to look at the full environment, and there's always going to be more people involved. And so I like what you say about having to think about the parent's role in co-regulating. I
Yeah.
say the same message for teachers, for staff, for caregivers, even for BCBAs.
Yes.
Learn that you can't just teach our kids how they're supposed to behave. We have to model it. I say the phrase a lot about being the thermostat and not the thermometer. Um, Easier said than done. I struggle with
Yeah.
that at home a lot. Um, but I think that I love that our field is moving towards at least acknowledging that that exists.
Mhm. Yeah, absolutely. I hear all the same things, and it's so interesting that all of us, we're really good at working with kids. We've been trained, we've been reinforced, right? We're good at looking at the child's context and thinking really about all the variables in play there. But when it comes to the adult, we kind of drop all that sometimes as professionals when it comes to parent training. Just like, here's the list, and this list of things is really good and it's backed by science, but that's the context for the kid too, like you said, it matters.
So what's the risk of us, as BCBAs, if we don't acknowledge the parent piece, and we continue to, they just need to just use the first N board. What's the risk? Like, what are we potentially exposing the parents to? We're adding stress. Is there burnout? Like, what could be the effects of that?
So there's actually some data on more ethical complaints to the BACB come from parents or consumers, and than from colleagues. And so I always think BCBAs are kind of picking on each other. And I would think that's who's calling the BACB, but it's parents who are complaining. And the reason any of us would complain about some sort of service provider is a lack of a relationship, right? You feel unheard by a physician, you're not going to go back. So that's what those issues with the ethical complaints and the data on that shows that these parents are going to leave that provider. They might jump ABA providers, or they might leave ABA entirely. And we know that ABA therapy can help that kid. We know that we want to support that child's learning, but a lack of a compassionate relationship is why parents leave. So it's not only like how far is the child's progress going to make with you in this current environment? Are they even going to keep coming? Are they just going to quit seeing you as a provider or quit ABA as a whole? That's really sad for that child.
Wow. So if you're, if the provider's listening to this and, they've been doing what we maybe did 10 years ago, or,
Ugh.
making some common mistakes, what could be the first step towards, wow, like I really need to support parents better or acknowledge the stress they're going through, or have a more compassionate approach? What could they do differently?
So if you are already in it and you feel like, oh gosh, I need to make some changes, like any behavior change program, we're not going to try to do a 30-page behavior intervention plan for you, a provider right now, right? So pick something small, whether that's reflecting before a session of, I am going to work on asking the parent how they are doing. That alone can be really powerful because the parent is used to the provider coming in and asking how the child's doing, how the data is, how the homework went. But it could be something simple like, I am going to slow down and not jump into my plan for today and ask the parent how they're doing. Or another really powerful one is pausing more. We want to fill silences. Humans, we don't like the silence, it's uncomfortable. But sometimes slowing down and just being quiet can be enough to let that parent speak more and really listen to what they're saying. So I would say pick something small. There's an article, I'll send you guys the reference. We can put it in the show notes. Taylor, LeBlanc, and Nosek, 2019, I'm pretty sure. There's tables in it with just these long laundry lists of compassionate behaviors that we can engage in.
Yeah, Linda LeBlanc, Bridget Taylor, they put together a really great article that lets us know and talks about compassion and compassion
Mhm.
towards parents. I love that article.
And how to
So you
define it?
just pick one or two of those at a time. If
Yeah.
you look through those definitions and all those long lists
Mm.
of the behavior analyst understands how it is for me to have a child with autism, the behavior analyst asks how I'm doing, the behavior analyst, that goes on and on and on. That's too much to try to do all of them. So as a practitioner, pick one or two and say, I want to get better at these. And put yourself on a little behavior improvement plan, right? Before you go into session, review your goals. I'm going to get better at these two. I'm going to say this, ask that. After
Mhm.
session, you
Such
reflect back. How did I do? Start
Such
small.
a good point because, so many times we're just so busy as
Mhm.
BCBAs, as parents, as professionals, we're all busy. And, that I've heard that, productivity over compassion or compassion over productivity. And they kind of do have to go hand in hand. And I think about it and I think about, okay, well, I've got to get in there and I've got to do this, 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 and this, and
Mhm.
this. I've got to see the therapist and I only have 2 hours and oh my goodness, my laptop's about to die. What am I going to do? Blah, blah, blah. And you got to get in and you got to check those boxes and you've got to get out. And sometimes, going in and taking a breath, slowing
Mhm.
things down, talking to parents doesn't do much for your productivity, but yet in the long run, it actually might, because if you've got that parent follow through, because you've now have developed that relationship with parents and now they're listening to you in the long run, it is not probably, it is way
It
more
will.
beneficial to slow down a little bit. I have to remind myself that as well, for sure.
And
I could just
time is the biggest complaint, right? We don't have time. And especially depending on the funding source, you have very limited time. So there's a book called Compassionomics. And this book is super dirty and I really like it. But it's a ton of research from the medical field on compassionate care. So physicians. And they do time studies. And what's interesting is that there's a magic number of how long it takes to move the needle with compassionate care, and it's 40 seconds.
wow.
That's it.
I need to read
The
that.
original study was really interesting. It's an oncologist, so someone with a brand new cancer diagnosis. Like, I can't think of anything heavier, that is such an intense situation. And so the original study, they gave a anxiety scale before and after the patient's visit with the oncologist, and they had a little scripted thing at the beginning and at the end of the appointment. It was scripted, and the doctor would say something like, we're in this together, we're on the same team. If you don't understand something, please tell me to stop and explain it. We're in this together. They've replicated that study over and over and over again in the medical field to show that just taking 40 seconds to explain your role as being a teammate and not the expert looking down can make a huge impact on patient care.
Wow,
That's
I would love to
incredible.
read that article. I could also imagine some BCBAs listening to this and thinking like, oh, this feels kind of uncomfortable. You're talking about breathing and pausing and feels a little outside of my scope.
Squishy.
Yeah, it feels like, I'm not trained in this. Um, how do we, what would you tell those BCBAs who feel like, is this within our scope as BCBAs?
The good news is we do have newer research like that article we just talked about and that the authors continue to put out in our ABA field that does support compassionate care, especially with caregiver support. So that's good news. It is within your scope as our field. Yes, 100%. And then the second piece, we haven't been reinforced for it because when we're in grad school, when we're in supervision, when you're in practicum, you're reinforced for being super technical. So that's our own learning history, right? We haven't been in those areas. So if you're not comfortable with it, then it's on you to get more training. You guys go to How to ABA. They've got all kinds of trainings. Like, but there's options out there. Learn more about it, A, and then B, take some of those little behaviors that we can pull from the articles and other places and start in the shallow end of the pool. I always tell people to pick the family that you already have a good relationship with, or maybe someone who's new to you. So if you have been working with a family for a long time, you've got this established relationship, you want to make it more compassionate, that's going to be harder than somebody who's new, where you get to start fresh. So if it's changing your behavior as a practitioner, be smart about it. Like, I can think right off the top of my head, like, ooh, I know which of my parents would be really on board with this. That's where you start. And then you start contacting reinforcement for using more compassionate care. So be smart with your own behavior change.
I also know that there is research for any behavior analysts who want more on ACT, which is behavior analytic. There is research to support that when people would do ACT with parents of children with autism, it helped improve the well-being of the parents and the child. So there is research to support the benefits of psychological flexibility, which should be something that we can, bring into our wheelhouse, learn more about it. But that is, can be behavior analytic, and ultimately, does a lot of good.
Nurbay Singh back in 2011 wrote an article about mindfulness training with parents. And, he did a study about children's negative behavior and he did nothing with the child. So no behavior service plan for the child. He only implemented mindfulness training with the parents for 8 weeks. And after that 8 weeks, they saw a significant decrease in child challenging behavior. So that is really interesting and it's powerful. Now, as a BCBA, when you say, Shayna, mindfulness and you've got to teach parents mindfulness, my first thing is, well, no. My skill set is token economies and my skill set is program development and skill acquisition and what have you. I'm not going to teach mindfulness to parents because it's outside of my wheelhouse. But there's lots of places you can go to direct parents. You as a BCBA don't have to be the one to be doing the mindfulness with parents. Leanne, you've got some really great resources.
Thank you. Yeah, I think that you can incorporate little pieces here and there, but if you're not comfortable, you feel like it's outside of your competence, then yes, send them elsewhere if you need to. But the research speaks for itself because it's been replicated so many times with self-compassion research for moms specifically. All of these different pieces can come together.
But I'm talking about, yes, as a BCBA, you should be saying, how are you doing right now? And taking that time. And I'm here, we're all in this together. I'm supporting you, but actually saying, okay, mom, let's breathe together. And I'm going to teach you mindfulness techniques. And when you hold that coffee, think about how black that coffee is and how warm it is. And it going to, like, that is not me. I am not that person. And I'm telling you right now, I'm not doing that to parents. But they're like, Leanne, you wrote a great book a few months ago, a journal for parents, and I read it and it was fabulous because it is all that squishy stuff that I don't have to do. I can say, hey, parent, here's a book. Let's go through this together.
Yeah, I hope it's a tool that BCBAs can say, yes, let's sit down and do this together. so that if it is uncomfortable for you as a practitioner and you're like, the very first entry in the journal is called sunset moments. And it comes from a quote from Carl Rogers that is, how do you view your child? As a math problem to be solved or a sunset to be enjoyed? And then the whole practice is about finding those sunset moments and really enjoying your child. So if you as a practitioner are like, there's no way on this earth I'm going to walk in and be like, let's find a sunset moment. Oh, how sweet and wonderful. But if you do walk in with my book and sit down and read through it, then you might be able to be like, so where's that sunset moment? And really, you're trying to build positive interactions between the parent and the child. There's more ABA behind it of what you're trying to do. But yes, let me be your squishy voice. I have no problem with that. I want it to be accessible to all parents, but accessible to all behavior analysts too, to infuse sessions with more of that compassion, with teaching parents to contact their own reinforcement through self-compassion, with psychological flexibility and ACT and all those things. So yes, let me take that for you. And you just follow up on the behavior side. Like, how did that affect your week?
Right. When I was seeing private clients, and even as I'm intaking new clients, I always have like a quote, like an ABA bin. So every new client gets a set of flashcards. They get a set of like things from the dollar store that are reinforcers that the therapist can use. The kids don't have access to the therapist, but it's kind of part of their package. And there's a few other things in there as well. But honestly, Leanne, I'm going to start adding your book to that package, because every parent needs to read that book. And it should be something that they don't just read in 5 minutes. It's literally doing a page a day for, all of the chapters that you have, because it is so great. And it's just about, well, yeah, like my kid isn't a math problem to try and be solved. I do enjoy, there are lots of things I enjoy about my child. Let's think about those. Okay. And that's it. That's it for the day. Okay, next day, go in and do something else, right? And I think that should be definitely part of most people's care package, so that they, A, don't have to do it themselves, and B, that parents can get that emotional regulation support that they need.
Mm. You
That's
talk
not
a
the
lot
nicest
about
thing someone could say. Thank you. Oh my gosh.
you've mentioned a lot about self-compassion, and compassion, and it really is the difference. And why is
Mhm.
self-compassion so important?
So Dr. Kristen Neff is the psychologist who kind of leads the self-compassion. Like, she has books that are mainstream, not super sciencey. So if anyone's interested in learning more about that in general, but self-compassion, especially for caregivers and for parents, it helps you contact that compassion without needing somebody else, right? So it's like reinforcement. We need to be able to seek out our own reinforcement, because if that caregiver is waiting for you, the BCBA, to come and say you did a good job, I mean, how often are you there? That's a long lag time in between. And self-compassion has been proven to really prevent some of the parental burnout that has become more and more prevalent. And parental burnout is a very real thing that's more than just saying I'm stressed or tired. There are certain indicators of it. And one of them is emotional detachment, which, if you reach that point as a caregiver, that's really, really hard. And so that's what we're trying to help our caregivers that we support who are in hard situations. There's a reason they have a BCBA at all in their life. So they're dealing with a ton of stress. So if the self-compassion can help prevent from that ever happening, why wouldn't we try to incorporate a little bit more of it, teaching parents how to care for themselves better? And it doesn't have to be this big woo-woo, yoga retreat that I would love to go to one, but who has time for that, right? Like, it can be little pieces here and there that are pulled from ACT research, from psychology research. They're not just made up pie in the sky things.
You make it sound so doable and really
That's the
not
goal.
overwhelming.
That's the goal.
Yeah. So something that we probably asked you last time you were on, but curious to hear if it's changed. What would be a recommendation that you'd give to either a newly minted BCBA or BCBA who might be struggling? What's your best advice to put out there?
It's a tough one. Just because I want to tell them lots of things. I would tell the new BCBA the same thing that I would tell parents, is to learn some self-compassion for yourself, right? And the pieces of self-compassion in general is speaking to yourself like you would a friend. So just being kind to yourself, So when that negative self-talk comes up of, I'm not good enough, I don't know enough, I haven't been doing this long enough, this is too hard, I'll never get through to this parent who's never going to follow through. If a friend came to you and said that, how would you respond? You wouldn't be like, yeah, you're terrible, you're not good enough, that parent's never going to follow through. I hope nobody would say that, right? So that being kind to yourself. And the second piece is recognizing that you're not alone. And loneliness is a huge indicator of job burnout and parental burnout. And so just even thinking about the fact that you're not alone, but also finding a community. Hello, How to ABA has one for you, right? Find a community of support to feel like you're not alone. And the last piece is mindfulness, which is like, hello, that's present moment awareness, right from our ACT psychological flexibility playbook. So really, I would encourage the same way I would a parent, a new BCBA. Yes, talk nice to yourself. You're not alone. And practice a little mindfulness, learn it for yourself. And then guess what? It's going to be easier to share with other people, with kids and with grown-ups.
Snuck in 3 pieces of advice there.
I know, sorry,
That's
that was a
kinda
really
good,
long
but they were all
answer.
really good. I will accept them.
I can't help it.
No, all so important, and I think I would agree with every one of them. We always like to part of what we do is helping people be better BCBAs, and I think those are
Yeah.
such great tips for being better people,
Mhm.
and then becoming better professionals.
Yeah. Yeah. And then it'll be easier to incorporate a little more of that mindfulness with the caregivers you support because you've done it for yourself first.
Yeah. Well, thank you. Thank you, Leanne, for being here.
Always awesome
Thank you
talking to you.
guys.
It's nice to
Thank
hear what you're up
you.
to, and I love what you're doing in terms of supporting parents and bringing compassion into the field, and it's so needed and so important. So thank you.
Thank you so much, you guys, for all your kind words and support too with my new journal. It's just so reinforcing to me.
I
So thank
love
you.
that journal. It is so
Ah,
great. For those of you who haven't seen it, honestly, go
oh, I
check it
actually
out.
have mine here.
Yeah,
I'm ready.
it's so
Sorry.
nice. And open it up. The font in it is like
It is
I keep
pretty.
talking
Well,
about
you'll
that.
see all
It's
my words.
readable.
You don't
It's
want
not
to
a
see what I've
textbook.
written.
Yeah, it's very, oh
Yeah.
yeah,
Yes.
yeah.
Some days I pick it up and I'm done in like 30 seconds and I'm like, oh, wait, that's on purpose. And then if you're in the mood, keep going. Even just yesterday, we had a rough morning here at my house and I picked it up to the page I was on, which I'm not doing a great job of every day. And that page wasn't speaking to the problem I was dealing with. So I flipped through and found one that did. And I was like, okay, now I can start the day. I got through the stress of the morning rush that did not go well, and was able to kind of hit a reset button for myself. So I'm using it too, and I hope
Yeah.
other people will too.
Love it. Thanks, Leanne.